get to Professor Abubakar now, Director Center for Infectious Disease Research, Bayero University, Kano. Dr. Ubochioma says we are making progress, but reports kind of say something different. In 2023, over 361,000 cases were reported. Meaning there's some that unreported, like Dr. Momodu rightly stated, and 26, which is actually 26% increase from 2022. And the report also says that 9% of these new cases are occurring in children. What exactly is the problem in dealing with this disease in Nigeria?
Thank you very much indeed. This should not be seen as a problem, actually, for people who know programs and for diseases that were hitherto difficult to handle as far as programs are concerned. There were fewer centers reporting cases and taking care of patients over time. But then with improvement in our health systems, more centers are coming on board to conduct the tests. More treatment centers are being identified and brought into the National TB and Leprosy Program. So we expect an increase in the detection rate. So the reported cases will definitely increase, as well as the number of people that are placed on treatment. So in a nutshell, unless this increase continues over a long-term period, we will, for the time being, consider this as an improvement in the program as far as detecting early diagnosis of the disease and then treatment of cases are concerned. But of course, we need to also increase in our efforts to conduct preventive measures, to carry out preventive measures at all levels, from the government, among healthcare workers, the communities, civil society organization, and all stakeholders need to work together to increase efforts aimed at prevention. But as far as this increase are concerned, in my opinion, it's a reflection of an improved performance by our health systems.
Professor, it's a reflection of improved performance. Tell us, please, how does TB actually affect the vulnerable people in the society? Like when I think the vulnerable population, I'm talking about children, pregnant women, and people living with HIV and AIDS.
Yeah, actually, tuberculosis, as earlier said, is a very infectious disease, and it is a devastating disease with a lot of complications, especially when untreated over a long-term period. So there are specific groups in the population that suffer the burden of tuberculosis more than others, just as the groups you mentioned. Of course, children who are supposed to be under the care of people whose immunity is not well developed start suffering from tuberculosis from their early days in life. And then for some of them, this will progress into secondary tuberculosis, and all the complications that tuberculosis is associated with may begin to manifest as time goes on. And these may include effects on the lungs, which from the common symptoms of cough, weight loss, night sweats, and fever, and coughing of blood, that is hemoptysis, it may progress into damaging the lungs and causing permanent lung damage, and so in some cases respiratory failure. So not only children, all the other groups, especially those living with HIV/AIDS whose immunity has been devastated by the effect of the syndrome, that is by the HIV infection itself. Because of their poor immunity, there is possibility of all these lung effects and then extra pulmonary effect, that is effects of tuberculosis in other systems of the body, which include the bones, the joints, the kidney, the brain, the liver, and the spine. All these are manifestations that may also complicate tuberculosis, and of course it can disseminate, spread throughout the disease, and in some cases cause septic shock and respiratory failure, and of course the resulting effect is death. So vulnerable groups such as the people living with HIV/AIDS, children, and people with other diseases like diabetes mellitus, which is a risk factor for tuberculosis, and so on, they may suffer from these problems more than others. And of course, that include people who are chronic alcoholics, and it can even be a risk factor for developing cancer, because some of the effects in the lungs may create a hole, and in some cases create a scar in the lung tissue itself. And of course, over a long time period, this can lead to cancer of the lungs. So there are a lot of effects on especially vulnerable groups. And of course, apart from the pathological effect on the health of the body, of course, there is the socioeconomic burden. You know, families that have patients suffering from tuberculosis also suffer from catastrophic expenditure. Although the government is trying to provide anti-tuberculosis drugs, but some of these complications that may result from tuberculosis are not under the national TB and leprosy control programs. And of course, the patients have to find a way of getting those drugs and the other measures needed for the treatment of the overall complications. And that pushes vulnerable families into greater poverty, because they have to forego certain things like food, like money they will have used for shelter and clothing and other important things like the education of their children. They now have to divert it into taking care of the patient who is suffering from complications of tuberculosis. So these are, it has a very wide range of issues, from morbidity to mortality to heavy socioeconomic burden, and of course, long-lasting disability, because some of the long-term effects are complications that lead to disability and handicapping conditions. And of course, the people have to live with them.